हेलो एंड वेलकम टू प्रोफेसर गाडगिल जीपैट एकेडमी। जीपैट 2027 की तैयारी कर रहे हो? सोचते हो कि फार्माकोलॉजी में एमसीक्यू सॉल्व करना आसान है? आज मैं लाया हूँ जीपैट एमसीक्यू धमाका एपिसोड 1, 10 हाई यील्ड फार्माकोलॉजी क्वेश्चंस, असली जीपैट पैटर्न। पहले पॉज करो, खुद आंसर निकालो, फिर मेरी एक्सप्लेनेशन सुनो। अंत में बताना आपके कितने सही आए। रेडी हो? चलिए शुरू करते हैं। बिफोर वी बिगिन, some questions are always asked on toxicology and rescue, targeted antimicrobials, and clinical vigilance. Now we will begin with the first MCQ. Naloxone is used as an antidote for poisoning due to A. Paracetamol, B. Morphine, C. Diazepam, and D. Iron. Answer is B. Morphine. Naloxone is a pure opioid receptor antagonist. It reverses morphine and all opioid effects, especially respiratory depression. Onset is within 2 minutes if given with IV, and duration is short for 1 to 2 hours. Hence, it may need repeated dosing. 1 to 2 questions from antidotes are asked every year. Now question second. Which of the following drug is a competitive opioid antagonist? A. Naloxone, B. Naltrexone, C. Flumazenil, and D. both A and B. Answer is D. both A and B. Both naloxone and naltrexone are competitive antagonists at mu, kappa, and delta receptors. Direct comparison between naloxone and naltrexone is a GPAT favorite. Naloxone is a short-acting for 1 to 2 hours, while naltrexone is long-acting. The clinical role of naloxone is acute rescue and reversal, while for naltrexone is relapse prevention and maintenance. The third question is, atropine in organophosphate poisoning is given to block A. nicotinic receptors, B. muscarinic receptors, C. alpha receptors, and D. beta receptors. Answer is B. muscarinic receptors. Organophosphates inhibit acetylcholine esterase, hence excess acetylcholine at all cholinergic receptors. Atropine blocks muscarinic receptors and controls secretions, bradycardia, and meiosis. Atropine does not reverse nicotinic effects, that is muscle weakness and paralysis. For that, pralidoxime or PAM regenerates the acetylcholine esterase. Trickshot for this is atropine, that is antistropine, that is anti-secretions. Atropine dries up secretions. Atropine is given first and PAM is given later. Order is important. GPAT asks this. Next question is, N-acetylcysteine or NAC is most effective in paracetamol poisoning if given within A. 1 to 2 hours, B. 8 to 10 hours, C. 24 to 48 hours, and D. 72 hours. Answer is B. 8 to 10 hours. NAC works by replenishing glutathione stores in the liver. Paracetamol toxic metabolite depletes glutathione, thus causing hepatocyte damage. NAC is most effective within 8 to 10 hours of paracetamol ingestion. After 24 hours, effectiveness decreases significantly. NAC can be given oral or IV. Oral NAC has 140 mg per kg loading dose to 70 mg per kg maintenance dose. This is a GPAT calculation and is MCQ favorite. Fifth question. Which generation cephalosporin is active against MRSA? A. First generation, B. Second generation, C. Fourth generation, and D. Fifth generation. Answer is D. Fifth generation. Ceftadolin and ceftobiprole are fifth generation cephalosporins. Only these have activity against methicillin resistant staph aureus, that is MRSA. First generation are gram positive active, second generation are gram positive and negative active, third generation are gram negative and positive, especially in the CNS, fourth generation are broad spectrum plus covers the pseudomonas, and fifth generation covers the MRSA. Sixth question is, which of the following is the DOC for the neonatal tetanus? A. Diazepam, B. metronidazole, C. penicillin G, and both A and B as D option. Answer is D, both A and B. Neonatal tetanus management requires two drugs. Metronidazole kills the causative organism, that is C. tetani. It is DOC antibiotic for tetanus and penetrates well in the necrotic tissue, that is in an anaerobic environment. It is also DOC for pseudomembranous colitis. Diazepam controls the muscle spasm and rigidity. It is a GABA agonist. It causes muscle relaxation, and it is also DOC for status epilepticus. DOC questions are or questions on DOC are always asked. 2 to 3 MCQs are guaranteed every year in GPAT. Question 7. Which of the following drug causes disulfiram-like reaction when taken with alcohol? A. Metronidazole, B. Ciprofloxacin, C. Amoxicillin, and D. Azithromycin. Answer is A. Metronidazole. Metronidazole blocks aldehyde dehydrogenase enzyme. 8th question. Which of the following drug is contraindicated in patients with glucose 6-phosphate deficiency? A. Aspirin, B. Primaquine, C. Paracetamol, and D. Morphine. Answer is B. Primaquine. Primaquine is an antimalarial drug belonging to the 8-aminoquinoline class. It causes oxidative stress leading to hemolysis in glucose 6-phosphate deficient patients. Next question is, which of the following is not a high alert medication or HAM? A. Insulin, B. Heparin, C. Paracetamol, and D. Potassium chloride injection. Answer is C. Paracetamol. High alert medications are the drugs with high risk of causing significant patient harm if used in error. Paracetamol in normal doses is relatively safe. Concentrated KCl injection or insulin or heparin, if given or has small error, can give the fatal outcome. High alert medication list include insulin, heparin or warfarin, KCl concentrated injection, chemotherapy drugs, neuromuscular blockers, epidural or intrathecal medications. Last question is, all of the following are LASA drugs except A. Celecoxib and ciprofloxacin, B. Prednisolone and prednisone, C. Amoxicillin and paracetamol, and D. Fenofibrate and fenugreek. Answer is C. Amoxicillin and paracetamol. LASA, that is look alike or sound alike, sometimes also called as SALA medicines, that is sound alike and look alike medicines. These drug pairs look or sound similar and hence high risk of dispensing errors. Amoxicillin and paracetamol are not LASA drugs. They don't look or sound alike. Common LASA pairs include celecoxib versus ciprofloxacin, prednisone versus prednisolone, fenofibrate versus fenugreek, lamivudine versus lamotrigine, carbamazepine versus carbimazole. तो कितने सही आए 10 में से? कमेंट में अपना स्कोर बताओ। अगर 8 या उससे ज्यादा आए तो तुम जीपैट के लिए रेडी हो। 8 से कम आए तो आज ही एमसीक्यूज की प्रैक्टिस शुरू करो। इस वीडियो को लाइक करो, शेयर करो उस दोस्त के साथ जो जीपैट की तैयारी कर रहा है। चैनल को सब्सक्राइब करो और बेल आइकन दबाकर ऑल सिलेक्ट करो ताकि अगली एमसीक्यू धमाका मिस ना हो। जीपैट प्रो आप डाउनलोड करो। 10,000 प्लस एमसीक्यूज 3 मॉड्यूल्स कंप्लीटली फ्री है। लिंक डिस्क्रिप्शन में है। टेलीग्राम ज्वाइन करो। रोज सुबह 8 बजे फ्री एमसीक्यू चैलेंज मिलता है। लिंक डिस्क्रिप्शन में है। अगला एपिसोड फार्मास्यूटिक्स एमसीक्यू धमाका। कौन से टॉपिक पर चाहिए कमेंट में बताओ। तब तक के लिए कीप प्रैक्टिसिंग एंड जीपैट क्वालिफाई होना है। प्रोफेसर गाडगिल साइनिंग ऑफ।